Well, good afternoon, everyone. Excuse me. My name is Melissa Gray. I am the Assistant Director of Transportation at the National Association of Area Agencies on Aging. I'd like to welcome you today for our Spotlighting Opportunities under Section 5310 and Promising Approaches webinar. Thank you so much again for joining us. I just want to go over a few housekeeping things today. These are just instructions for our Zoom meeting participation this afternoon. As you know, all participants are muted. We ask that you please stay muted unless you are speaking. The session, as you know, is being recorded and will be sent via email along with slides and our evaluation. All materials will be put on the NADTC website. Closed captioning is available if you would like that. You can turn captioning on or off by clicking on the CC button at the bottom of your screen. And we will have a formal Q&A section at the end of our presentations today. So we ask that you would please submit your questions in the Q&A box by clicking on that feature at the bottom of your screen. We ask that you please don't submit any questions in the chat feature, but chat is open and can be used for general questions or technical assistance. And with that, I'd just like to go over our presenters for this afternoon. You'll first hear from Tracy Wilson, who is the Director of Research at N4A, followed by Virginia Dyes, Director of Transportation at N4A and co-director of the National Aging and Disability Transportation Center. She will be followed by Ken Pollock. He is the Transit Director at Bay Transit. And finally, David Klein, Administrator with the Area Agency on Aging, Old Colony Planning Council. So with that, welcome again, and I will turn things over to Tracy.
Great, thank you so much, Melissa. We are so pleased that you could join us today to discuss AAA involvement in transportation programs and new opportunities under Section 5310. I think that all of us in this webinar appreciate that transportation is a critical link that enables older adults to remain independent and living in the community. It connects older adults to services and necessities, medical appointments, grocery stores, pharmacies, and social activities, and it helps older adults access necessary services and participate in meaningful activities, reducing the risk of social isolation and improving quality of life. So I will spend just a few minutes at the beginning to provide some context, kick off by sharing some data from our most recent AAA National Survey, which was conducted in 2019. And we will leave plenty of time at the end for question and answer. So the AAA National Survey has been conducted about every 3 years since 2008 with funding from the US Administration for Community Living. It gives a snapshot of the evolving role of AAAs in the planning, development, and coordination and delivery of aging and other home and community-based services. You can see the full report on our website, n4a.org/publications. Next slide, please. So first, from the national survey data, we know that about 89% of AAAs are involved in providing transportation services, either directly or through a contracted provider. 73% of AAAs contract with a provider for transportation services, and 28% of AAAs provide these transportation services directly. And of course, there are some AAAs who do both. We'll hear examples from folks who are contracting directly and directly providing services later in our presentation. Next slide, please. So let's look at the types of transportation services provided. Of those AAAs who provide transportation services, 83% offer assisted transportation, a service for older adults who need assistance from the door to the car or someone to stay with them throughout their trip. 73% of AAAs provide non-medical transportation, and 59% provide wheelchair accessible transportation. Almost half of area agencies on aging provide non-emergency medical transport. About a third have a volunteer transportation program. 24% offer transportation vouchers, And a small percentage, about 5%, have partnerships with rideshare companies such as Uber or Lyft. And again, this data is from 2019. So, we know that things have changed quite a bit in the past year and a half, and we'll be talking about that a bit later as well. Next slide, please. So looking at how these transportation services are funded, for 2018 fiscal or calendar year, AAAs reported 60% of AAAs reported that they were receiving federal, state, or local funding for their transportation programs. And when asked about how that funding had changed over the previous 2 years, most said that had remained flat. 37% of AAAs said it remained flat. 15% said it had increased, and 7% that it had decreased. 40% not applicable. And transportation funding ranges from 0 to 59% of a AAA's reported annual budget, and the median amount of budget is 4%. So transportation funding makes up about 4% of a AAA's budget for those who do receive that funding. Next slide. Of course, COVID has drastically changed the demand for transportation services. We know there's a sharp decrease in these, but that demand has been ramping back up. Recent data from the Elder Care Locator saw a 28% increase in transportation questions in the 6-month period from December 2020 to May 2021. So I don't have data about how demand is relative to pre-COVID. So I'd like to just pause here briefly for a moment for a quick poll of attendees. And I would like you to answer the question that pops up on your screen. Is the current demand for your transportation services lower than COVID-19, about the same, higher than before COVID-19, or it's not applicable to you? All right, so once you see that poll pop up, go ahead and select one and submit it. And then when we receive a fair number of answers, Melissa will share the results with us. Okay, so it looks like 30%, so 23% of you said it's not applicable. It's fairly evenly split between lower and higher than before COVID-19. And then slightly smaller proportion, about the same as before COVID-19. So really all over the board. Very interesting. Thank you so much. So with that, I'm going to turn it over to Virginia to talk about NADTC.
Good afternoon, everybody. Next slide, Melissa.
One moment, Virginia. I've lost my slides on my computer, so give me 1 second. Thanks a lot.
Okay. Well, I'll just start talking.
Yeah, absolutely.
Why not? So I co-direct the National Aging and Disability Transportation Center. And for those of you who are not very familiar with us, let me just remind folks that it is a partnership between N4A, the National Association of Area Agencies on Aging, and Easter Seals, and we are funded by the Federal Transit Administration. That partnership actually predates the current NADTC and goes all the way back to 2006, when we used to be the National Center on Senior Transportation. So it's a longstanding partnership that we have worked with Easter Seals and gotten funding from FTA to do work in this space. Our mission at NADTC is to focus on the availability of accessible transportation. And by that, I don't just mean wheelchair access. I mean access that really makes it possible for people in their communities to get a ride when they need it, to go to have a service that gets them where they need to go, and that there's also the availability of information in the community about how to access transportation and what kinds of services are available. So as you can see, access is an enormous issue. And you can have really great public transit and still, with older adults and with people with disabilities, they may not be able to travel well because for whatever reason, distance from their homes, the availability of accessible vehicles, et cetera, can still inhibit their travel. And so in order to have accessible transportation options for older adults, people with disabilities, caregivers, and communities, there needs to be an array of services. NADTC does a lot of person-centered technical assistance and information. We have available a toll-free number and a website that is meant to meet many of those needs. We also have a designated email address where particular inquiries can be made. Our focus is on helping individuals who work in this space, who work on transportation for older adults and people with disabilities. We also do a lot of training. And I just want to say that we have a national meeting coming up that I hope that you all will check out and hopefully participate in. On September the 1st, from 11 to 12:30 Eastern Time, we'll be holding what we're calling a national convening. And at that meeting, we'll be sharing some of the highlights from the national survey that we just completed. That survey was conducted with older adults, people with disabilities, and caregivers from diverse populations, from underserved populations and populations that traditionally have been underserved and marginalized in their communities. So we have some exciting information to share, and it's a preliminary piece of information from what is going to be a much longer report. So we're very excited about that meeting and hope that many of you all can join us. We do a lot of communications and outreach. We just in June updated pieces of our website, updated the look, and hopefully made getting access to particular kinds of information much easier. So we hope that if you're not familiar with our website, you check it out and you'll use our website to sign up for our e-news. We do a lot of coordination and partnership. And finally, we invest in local communities by doing a competitive grant program. We have a grant program out in the field right now. Applications close on the 27th of this month. We're looking for, we will fund up to 10 grants. These will be planning grants that will focus either on serving diverse populations in your community or recovering from COVID with your transportation program. And I found the results of this poll very interesting because you're responding now. And I think that some of the impact of COVID has been greatly diminished over the last several, I'd say 2 or 3 months, since communities have opened up more. When we did our poll back in the spring, we found a much bigger impact from COVID on the demand for transportation. So thanks for doing that poll, Tracy. Next slide. So I want to talk very briefly about a survey that we did in 2019, ironically the same year that the AAA survey was done. And in our case, we did a survey of transportation providers that serve older adults and or people with disabilities. And we found that the #1 respondent to the survey were, of course, public transit organizations. But the second highest response rate came from area agencies on aging. So 21% of the respondents identified themselves as area agencies on aging. 10% of respondents identified themselves as ADRCs. And one thing to understand is when we asked respondents who they were, we gave them quite an array of choices, and some people checked more than one box. So many of the folks who said they were AAAs were also ADRCs, but not in 100% of the cases. Next slide. So I want to talk about funding. Funding is, well, you can't talk about transportation without talking about funding. It is the big elephant in every room when you bring the topic up, because I don't think there is a transportation program in the country that would not say they would greatly benefit from additional funding. They occasionally, or more often than that, have to turn people away, either because the kinds of rides they provide don't meet their needs, or they simply have such great demand in their community that they can't meet it all. So there are two really important sources of funding that I want to point out that our respondents to the survey said that they use. One is the FTA program called Section 5310. I hope that most of you all are familiar with this program, mainly because it is that program, that formula funded program that is administered by the Federal Transit Administration, that is focused on the needs of older adults and individuals with disabilities. There's great flexibility in the program to use funding for vehicles as well as for services, as well as using administration funds. I'll talk a little bit about some of the things that 5310 particularly enables. The other issue I want to point out is that among all sources of funding, you have about 52% of our respondents saying that they use Section 5310, whereas it's something like 38% are using Older Americans Act. And we assume we're talking about Older Americans Act Title 3B, which is that part of the Older Americans Act that provides great flexibility to area agencies on aging to decide where that money can best be used. If you look at primary sources of funding, you find that about 29% of the respondents said that their funding source, their primary funding source, is Section 5310, whereas with Older Americans Act programs, about 26%, I'm sorry, I can't see these numbers really well, my own aging eyes, 26% said Older Americans Act funding was the primary source of funding for their transportation program. And of course, state funding figures very largely as a source of funding. Next slide, please. When we did this report last year from our 2019 survey, one of the things that really excited me was this particular slide, because it shows something that I have said 100 times, I'm sure more than 100 times, when I've made presentations. And I think it's a very critical thing to point out. When you're talking about transportation for older adults and people with disabilities, you need programs all across the country are dependent on using a patchwork of funding. None of these sources proves to be totally adequate for meeting the needs of this population. And so it's important to patch together different sources of funding. You see that Section 5310, if you look at the Area Agency on Aging column that I highlighted, you'll see that Section 5310 accounted for about 30% of AAAs who responded of their funding for transportation, whereas a whopping 68% of the AAAs who responded said that they are using Older Americans Act funds. And you can see that they're using state funding, the Section 5311 program, which is primarily focused on rural areas. And I know that that's a big focus of what we're talking about today. About 23%, I think it's 23, I'm sorry, 29%. My eyesight is not what it should be. Are using county funds. A very small percentage depend on fares. And we know that many programs try to offer free fares or at least income-based fares for their services. There are also donations here, and that is to be expected from area agencies on aging, of course. Voluntary donations are very important. Private funding, city, other local sources, as well as the 5307 program, which is primarily used to purchase vehicles, and other FTA funding. So that other category is something that's really not commonly used by area agencies on aging, apparently. But you see that it really takes a village. It really takes a patchwork of funding to support transportation for older adults and people with disabilities. And it's a challenge for this field. Next slide. Okay, this is my last slide that I'm going to be using to talk about that survey. And it's, again, pointing out what 5310 funding can allow programs to do. What we did was we compared the responses of those who said that they got 5310 to those who do not. And we found that organizations that get Section 5310 funding, including area agencies on aging, were more likely to have a mobility manager on staff. And we know that mobility managers are critical for providing information about transportation, helping older adults and people with disabilities make the right transportation choice, scheduling rides or helping to schedule rides. They play a very critical role also in identifying where there are gaps in service. And then providing services to both older adults and people with disabilities is more common among those programs that get 5310. Providing rider assistance, and finally, offering that critical flexible weekend scheduling that so many people need and so many programs are just unable to provide. Okay, next slide. We're going to talk about a poll, and Melissa's going to put the poll up. This poll is about your top related transportation related training or technical assistance needs. We put 3 choices up there: more funding, starting or growing a volunteer transportation program, finding partners to support your efforts to increase transportation in your community, or something else. And for those who check something else, we invite you to go into the chat section and to share with us what some of those issues are. So we'll give that a couple of minutes or a few seconds to be completed, and then Melissa will show us the results.
People are still voting, so.
Okay, well, we're
Yeah.
getting some very interesting things from the chat. One is a need for more training about how to run a program. Okay, so this is an interesting poll in that more of you are looking at ways to develop partnerships to increase the transportation in your community. Slightly more of you are saying that that's the issue rather than funding, though I suspect that some of you all might have hit more than one choice here. So we really, really appreciate it. Thank you very much. Growing, of course, growing volunteer transportation programs, we're starting them. We find through our work at NADTC that that is a very critical issue. So with that, Melissa, you can close that that poll. And my last slide is actually contact information. And with that, I'm going to be turning the podium, the virtual podium, I should say, over to Ken Pollock from Bay Aging, and he will be followed immediately by David Klein. So Ken, it's all yours.
Thank you, Virginia. I appreciate the opportunity to speak with you today. My perspective that I'm going to talk about is the role of the AAA in getting involved and running a public transportation service that is part of an area agency on aging, as well as our impact of COVID and how we responded to it. Bay Transit is a division of Bay Aging, which is the area agency on aging for the Middle Peninsula and Northern Neck region of Virginia. It was founded in 1978, and it provides a wealth of direct services for older adults and a few services for younger adults as we start expanding and seeing what the needs are in the community. Next slide. Bay Transit began in 1996. We started in Gloucester County with one bus, and I think that's the actual bus right there. We were funded through a state demonstration grant from the Virginia Department of Rail and Public Transportation. The continuation funding has been through 5311 funds. I believe in the 1990s, there was a real push to expand public transportation into rural areas. I know particularly in Virginia, there were no service providers, and that's how Bay Aging got involved. We had some experience with senior transportation, Meals on Wheels, and so we forayed into the rural public transit world. And I know there's at least 6 other area agencies in Virginia that continue to operate rural public transportation systems as well. So moving ahead 25 years, next slide, please, Melissa. Now Bay Transit, this is our 25th anniversary. We are providing rural public transportation to 10 counties in the Middle Peninsula and Northern Neck, as well as Charles City and New Kent counties, a rural area along the eastern portion of Virginia. We cover 3,000 square miles, and we are larger than the state of Delaware, our service area. We operate and maintain 2 administration and maintenance facilities. Our area is so large that we can't all be at one facility, so we have 2 facilities. The majority of our service is demand responsive, curb to curb or dial a ride service. You may be familiar. People call in advance, they schedule a ride, we come and pick them up. That's what the majority of our service is. We're also now operating 3 flexible fixed routes. We have a mobility management program, and I'll talk a little bit more about that in a minute. We have 3 seasonal trolleys we operate during the summers in 3 of our smaller tourist towns. And we continue to provide senior center transportation and some Meals on Wheels delivery when the volunteers aren't available for Bay Aging. Next slide. In an attempt to expand services and to utilize the 5310 program funding, in 2012, we hired a mobility manager and began a New Freedom Human Service Transportation program. Now, this program is specifically for seniors and individuals with disabilities and provides transportation outside of the Bay Transit service area or outside of Bay Transit service hours. We are in a very rural part of Virginia, and so there is often a need for more specialized medical services, cancer treatments, shopping, and things like that. So we provide that service for folks that qualify for the program. It's been a very popular program. We actually don't provide all of the service ourselves. We don't have enough drivers and vehicles to do that. We also contract with some local mom and pop non-emergency medical transportation providers to help us meet the demand. Pre-COVID, the last year before COVID, we provided about 3,800 rides. We could probably do a lot more than that if we had additional funding and additional drivers and additional vehicles, because the demand is huge for this service. It's a very popular service for us. But speaking of COVID, next slide. We about a year and a half ago, we, as everyone did, were hit with COVID and trying to figure out what we needed to do. How do we proceed with our transportation services? First thing we did was we started discouraging people from riding. We did not want to be a super spreader. And so we just cut our services down to essential workers and essential health needs. So we were taking people to work at the hospital or at the nursing home, or we were taking people to dialysis, but we were taking very few people. We had to reduce our seating capacity from 14 to 3. And we also shut down our New Freedom program because those were smaller vehicles, and we just felt that the opportunities for spreading the virus were too great. So after a few months of that, we started trying to figure out how can we be more proactive? What can we do to make it safer for people to ride the buses, for our drivers to drive the buses? So the first thing we did was we suspended fare collection. We did not want drivers and passengers having contact with each other. Then we installed plexiglass shields around the driver cabin, and you can see an example of that here. And that was to shield the contact between the drivers and the passengers. Then we implemented a few more safety protocols. Next slide, please, Melissa. We developed a Good to Go campaign where we were promoting that it's now good to go, you're good to go on Bay Transit. We installed plexiglass shields behind each seat in our buses. This allowed people to feel more safer. It allowed us to increase our capacity from 3 to 7, which really was a big help with regard to getting more people on the buses. Next slide. We installed a sanitation station at the entranceway to the bus, at the passenger door. We put a little dispenser of sanitizer, and we also put in masks for everyone. We even upgraded to a touchless dispenser you can see on the right. Next slide. We installed some HEPA microfilters in our air conditioning systems to better get some of the particles out of the air that might be helping to spread the virus. Next slide. And then we started promoting this campaign. We had bumper stickers made announcing what protocols we had put in place, and we called it Good to Go. Next slide. We created some flyers. We put them out around the community, handed them out to the riders. Next slide. We did photo ops with county administrators and county officials. We put our ad and promotion on the sides of the buses to make it clear what we're doing and that you're good to go. Next. We did press releases in some of our local small town papers that are within our service area to get the word out. Next. That's another local newspaper we put an ad in. Next. And then we also went to the radio stations. We purchased airtime. We did phone interviews live on air for many of our radio stations in our community. What we found was that by October of last year, our ridership was up to about 80% of our pre-COVID numbers. And our flexible fixed routes, we were actually seeing some that were exceeding our pre-COVID numbers. People were ready to get out. They'd had enough, and they were, so we're really pleased with the impact that this campaign had, and the Good to Go slogan on getting people back riding our buses, getting out as much as possible and as safe as it was possible. I'd like to finish my portion of this webinar by talking about the value of rural public transportation. I can't tell you enough the impact. Yeah, go ahead. I'm sorry, Melissa, you're fine there. The impact that the Bay Transit has had on the community, in our rural community, for many people who are transportation dependent, be they older adults, people with disabilities, people that can't afford cars, or people that are no longer allowed to drive for whatever reason. It's been tremendous. And one of the things that I related back to our AAAs, and this is true for Bay Aging, part of our mission is to do all the things that we can to help people in our community remain independent, live at home, and age in place for as long as possible. And that's part of many or most of the AAA's missions around the country. But you'll also see many of those same AAAs when they review needs assessments for their communities, that transportation is invariably in the top 2 or 3 with regard to gaps in services for helping support the goal of independent living. So public transportation, but rural public transportation in particular, is very, very important when people have no other options, and there is no Uber, there is no taxi services, there's nothing. It's really important. And so in closing, I'd like to share a little video from Mr. Art Doobie. Next slide, please, who is a resident in our area and a user of Bay Transit.
Without Bay Aging, I would not be able to continue living at home and staying in the community.
Art Dubby is a 78-year-old Vietnam War veteran who has lived in his Matthews County home for many years. As Art's eyesight began to deteriorate, he needed an alternative to driving himself to continue living an active social life. Today, Art relies on Bay Transit to get him around town, to social functions, and help him lead a full, mobile life despite his visual impairment.
With Bay Aging, I'm able to go to the wellness center twice a week. I can go to Walmart. I can go to my doctor.
Bay Transit is a division of Bay Aging, founded on the belief that every citizen must be assured accessible, safe transportation to the destination of their choice, without regard to disability, age, or economic status.
I would encourage all organizations to donate to Bay Transit so that they can continue doing the great work they do today.
Since 1996, Bay Transit has been providing public transportation services throughout the Middle Peninsula, Northern Neck, and New Kent and Charles City counties. Every year, Bay Transit provides over 140,000 rides, enabling people to get to work, medical appointments, shop for groceries, and attend social engagements. Bay Transit improves people's lives by making their communities more accessible.
Because of Bay Transit, I do not have to worry about my legal blindness keep me from community activities.
And that concludes my portion. David, I'm going to turn it over to you.
Thanks, Ken. Hi, everyone. My name is David Klein. I'm the administrator of the Area Agency on Aging for the Old Colony Planning Council, which is services an area of 1 city and 22 towns in southeastern Massachusetts, just about 30 miles south of Boston. We, next slide, Melissa, please. Our funding for our AAA is supported from a transportation perspective in two ways. Actually, according to Virginia's survey results from before, it won't be surprising. The two sources of funding, the main sources are Title IIIB, Older Americans Act funding, and the secondly would be the FTA's 5310 Operational Assistance Program, for which we operate a volunteer transportation program to provide mileage reimbursements for volunteers at our local elder services departments, which here in Massachusetts they usually call councils on aging. Next slide, please. I wanted to offer some metrics, both pre-COVID and during COVID for our program. The volunteer transportation program at OCPC has been around for 20 to 30 years. Again, it's offered through our local councils on aging, which is part of our elder services network here. And the mileage reimbursements are provided to between 40 to 50 volunteer drivers who provide about 100 free rides on a monthly basis. I think the big difference between this presentation of indirect services and what Ken was presenting for Bay Transit is we are not a direct provider of services. We contract out or work with our partners to actually provide services. During COVID, particularly the first few months of COVID in 2020, we saw a rapid decrease in availability of volunteer drivers. And mainly it was because the councils on aging or elder service departments, senior centers, et cetera, themselves had to close down or close down to incoming participants, and only the staff were allowed to be there, if that. So we ended up with really less than 5 drivers per month. In 2 months, we only had 1 driver in the 23 communities we serviced. So it went from the full capacity of 100 or more rides to less than 10 rides, and in some cases only a few rides. So that was a severe result of COVID. And on another slide, I'll show you how that corresponds to a response from another transportation service provider in our region. What we have discovered is that there has been a slight rebound in the number of drivers available, but not as much as one would think. We've ramped up to maybe 5 towns that are back providing these volunteers, and so we hope it'll come back soon. But we are actually having issues spending down our 5310 grant funding in the interim. Next slide, please, Melissa. And so because of this lack of ability to spend down our 5310 funding for the volunteer transportation program, we're working with MassDOT, that's Massachusetts Department of Transportation, to expand the small portion of our 5310 grant to use towards alternative transit services. I know Ken just mentioned that a lot of times the ride sharing firms such as Uber or Lyft are not available in rural areas. Fortunately, in the more suburban and urban areas, they are available. And so that's another avenue where we can subsidize transportation for people. And if we go to the next slide, Melissa, I'll actually provide an example. So if you are an individual who doesn't have a smartphone, or if you're trying to provide ride sharing type of transportation for a relative or a close friend that may not have access to a ride sharing app like Uber or Lyft, you might want to go through a company that actually facilitates the summonsing of Uber and Lyft rides. And the one that I'm familiar with, there may be others around the country, is a firm called GoGo Grandparent. They operate 24 hours a day, 7 days a week. And you could call them, you could call GoGo Grandparent and arrange a Lyft ride or an Uber ride for, a loved one, or somebody could arrange a ride for themselves without actually having a smartphone and having access to the app. One of the things that GoGo Grandparent does, which is kind of cool, is they have what they call their GoGo Guardian program, and they track the rides. And it doesn't say it here for safety purposes, but they track them, and then they'll send a text out to let the person who arranged the ride know that the person has arrived safely. They also advertise that will try to find the suitable drivers for the individual person who's taking the ride for their needs, no matter what those needs are, whether they are a wheelchair or perhaps they have a hearing issue or a sight issue. Moving on, a more local example would be a not-for-profit. And so a couple of years back, some of the areas in Massachusetts started pilot programs, and in the Plymouth County area where we are, south of Boston, a pilot program was started. It was called the Transportation Pilot Program, and they just recently, after 2 years, have formed full not-for-profit status, and they changed their name, keeping the TPP acronym, and changed their name to Taking People Places. That's a very recent development. The following 3 slides, and you can go to the next slide, Melissa, please, will examine their reporting over the next 3 years. So this is the TPP, their new logo and their new trademark name. And we're going to examine some program metrics that they gave us. They were kind enough to give us between 2019 and 2021. As you can tell, it bookends almost a year before COVID began, and now almost a little more than a year after COVID ended. Well, COVID hasn't ended, but before we first found out about COVID. Next slide, please. So on the left, you can see that they started off in the first quarter of 2019 with 118 rides. That quickly in the following 2 quarters ramped up by 600% or more. So the first quarter, I'm chalking up to the fact that they were just getting the word out that they existed. The first quarter of 2020, they were a little bit lower, but in the Northeast, we really had some terrible weather in the winter months. So it's not uncommon for transportation figures to dip in the wintertime through January through March. But what was really shocking was how the number of rides, again, in April through June of 2020, when COVID was really, we were in the grip of COVID-19, their rides dipped back to 122. And then as things improved a little bit, they've seen a slow rebound back up to 400, almost 500 rides in the next half year. And in 2021, so far, they've been over 500 rides per quarter. And it just seems to be a metric that is going to increase as they get more people get the word out and are more comfortable with that mode of transportation. TPP currently contracts with Lyft for their rides. And you can see the little graph there, what their peak transportation was, where it was during the pandemic or the worst of the pandemic, and where it's going to be going during the recovery. And it's kind of a slow increasing slope during the recovery. Next slide, Melissa, please. I think this is the last slide for TPP. What I really like about this slide, and again, I so appreciate their help with this, is on the left side, they have a graph, they have a listing of the type of rides that and the purpose of rides that they did. And very interestingly, a significant over 50% portion of their rides were to take people for employment. I know that one of the member organizations that belongs to TPP is the ARC. So I think that there are people that either just need transportation to employment, or that would either they're physically or mentally disabled that would have no other way of getting to employment. So in a way, that's a good story. The second most popular purpose is something that we in the Area Agency on Aging world know very well, and that's the medical rides, 988. So that represents, if you look over to the top right, that about 12.12% of the rides were for the elderly, and another 10%, almost 11% for physically disabled, and again, a very large proportion for mentally disabled. I think that the 12.2% tracks pretty well with the US population of people over age 65. I know the population over age 60 is much higher than that, closer to 25 or 30%. But I think that so far, it looks like they're really doing a good job providing transportation resources for those who would otherwise have no means of getting there. And where we're coming in with this is we're asking our Department of Transportation area if we can actually help fund some of their organizations that belong to Taking People Places, Inc., so that they can possibly do even more rides. They have some ride statistics there. The average cost of their ride is $23.90. However, that does not go to the individual. That is completely subsidized, 50% by a 5310 grant, and the other 50% by the member organizations. And interestingly, the last bullet point on that slide says approximately 85% of the rides are during the weekdays and 15% on the weekends, and that stands to reason as well. Last slide. Thank you. Thank you for the time to present today. I think maybe we're running a little long, so I'll end it here and just point out that my contact information, email address, and phone number are available in case anybody has any questions or would like to contact me. Thank you very much.
All right. Thank you so much, David and Ken, for sharing your agency's experiences and what you've been going through lately. We have a number of questions that have come up in the Q&A, so I'm going to jump right into it. Two of them are related to offering rides to people of different ages. So it says, Ken, how did you decide to offer transportation to people of all ages? What might inspire another AAA to offer mobility management or transportation for everyone who needs assistance, not just older adults? And then related to that is just interest in sharing rides among different ages and populations to make rides and trips more cost effective.
Well, the short answer is funding. Although I wasn't here in 1996, I did start in 2000 and we were still very young. But the federal rural public transportation money, which is much more plentiful than and that's the 5311 funds, are much more plentiful than the 5310 funds. But the caveat is that you have to provide public transportation for all ages in order to access that money. You don't have a choice. So it was a big decision for our agency because I think it was the first venture that we had that wasn't specific to an aging population, that we were actually stepping out of our comfort zone to offer services to people that weren't in the older citizens category. So that was the driving force behind choosing to provide public transportation. Plus the need was there. It was such a great need for everybody, not just seniors, that it was the decision that we made, and we're glad we did. And what was the rest of that question?
I think you answered it, so thank you. Mm-hmm. A couple more questions that are related to each other. Is there a formula for effective relationships or partnerships between AAAs and transportation agencies? And what would you recommend to AAAs looking for partners? So recommendations for partnerships between AAAs and transportation agencies.
David, you want to?
I was trying to unmute myself. I saw that question come up, and I've actually been sitting here thinking about it. I think the answer, I guess the short answer is I don't know, but the reason is that because there's such a difference between the AAAs in each of the regions and the transit agencies in each of the regions. And so one of the things that I find also is that the AAAs may have one geographic area that they're serving, and the transit agencies might overlap, but not fully cover that same geographic area. It might not be the case in Ken's area, for example, because as he said, their catchment area is bigger than Delaware. But in our area, the transit agencies are covering certain small areas, and the AAAs are covering certain other smaller areas. And there is some overlap, but sometimes we've actually find that people are in competition with each other, particularly the transit agencies are in competition with each other. So I think it's a hard question to answer.
Yeah. And for us, there weren't any transit agencies for us to lean on or work with. We do work with other private providers to do some of the New Freedom program that I mentioned, but we just don't have them in our region to partner with.
Tracy, there was a question there that I'm seeing. It says, here at the Area Agency on Aging in Southeast Michigan, we partner with Lyft Concierge, and we're able to schedule rides also like GoGo Grandparent. I'm very familiar with that. The Lyft Concierge service is what TPP and their member organizations use to deliver rides for people. The big difference, and I ran an agency for the town of Carlisle in Massachusetts, near Concord, Massachusetts, where we had a Lyft program as well. The big difference between running that program yourself and an organization like GoGo Grandparent is GoGo Grandparent's available 24 hours a day. And what we found at our Council on Aging was if we were providing a Lyft ride for a medical appointment, let's say in the morning, it was not an issue. We could get the person there. But if we were providing, and home, but if we were providing a Lyft ride for a doctor's appointment in the afternoon, it could be that by the time the person finished, there was nobody back in our agency to actually answer the phone to provide the return ride for them through Lyft Concierge. So, I guess it depends on the amount of staffing hours that you have in order to be able to do that.
That's a great point. It looks like the Roberta says says that's an issue with her agency as well. Related to rideshare companies, we found that healthcare providers will not discharge a day patient to rideshare companies or a taxi. Is that something you've encountered?
I have not seen that. Maybe it's a liability issue on their end, or I'm not quite sure. I can understand where they would want to, where the healthcare companies would want to be protective of their patients. That's understandable. But on the other end, I think there's an imperative to be able to get the people there in the first place.
Tracy, could I interject something? I think a month or so ago, I think it was in June, NADTC did a webinar with an organization called Trusted Ride. And that particular model is focused on this issue about folks who have day surgeries and issues where the healthcare providers say you have to go home with someone. And when family members and friends are not able to do so, people sometimes have to pay exorbitant fees to some of these medical transportation providers to get home. So this trusted ride model, and we have the recording of that website on our website, of that webinar on our website, is really about volunteers who serve as those companions. And they can sometimes, partner with Lyft or Uber. They can also provide this service in a taxi, etc. And there are a couple of sites where Trusted Ride has been operating for a while. One of their sites is in Baltimore in a partnership with a hospital. So if you look that up, and we will include that link as a follow-up to everybody on the call so that they at least have that information.
That's fantastic. Thanks. And it looks like we're at time already. Unfortunately, time flies when you're having fun. We have some more questions in the chat, but maybe we can follow up offline by email, and we will be sending out a survey afterwards that has popped up in the chat. And just want to thank you all so much for coming today. And we look forward to continuing this conversation with you. It's clearly an important topic, so we'll try to make other opportunities to get together and discuss these important issues together. So, anything else from you, Virginia?
Just a thank you to our two fantastic speakers who really, I think, provided tremendous descriptions of what's going on in their communities and kind of opened up the conversation to how complicated these issues are. And some of these questions we will definitely feed to our speakers and see if we can get some additional responses and share that with the group. So thanks very much. We appreciate it.
Thank you.